Welcome back to Open Line, talking about healthcare expansion in Tennessee. We have with us Andy Spears, Executive Director of Tennessee Citizen Action. State Senator couldn't make it tonight. He's doing legislative stuff. They're working late as the session is beginning to wrap up. But this has been a big issue. We have several callers, so let's go to the phones right now. Let's go to Greg. Hello, Greg.
Hey, thanks for taking my call, guys. I got a lot to say, but I just don't have time to say it all. The gentleman here is saying how this is, it's not going to cost the taxpayers anything. We got to remember that we just filed our taxes, and the federal government takes my money. So
Right.
The federal government has already taken my money to pay for programs like this. So what we need to do is not allow our federal government to use money it's taxation without representation. Our government takes money from us and spends it on the things that they want to spend it on. What we should be talking about in our legislative plaza and at our state capitol is how we can allow businesses and people to open up their own insurance companies to provide health insurance for us and bypass the federal government altogether, because that's just a socialist setup. That's what socialism is. It's the government controls and owns all businesses and controls everything, and this is just an example of them wanting to control our health care. So to say that it's not going to cost the taxpayers anything, it is, because the federal government taxes me and they use that money to fund this.
All right, well, I appreciate that. Let's talk about that. What do you say about what he's saying there?
Well, so I think one thing, as a Tennessean, I want my money back. So just like this guy, I've filed my taxes over the weekend, and I want my tax money back. This is a way to ensure that almost $2 billion of Tennessee tax dollars that we've sent to the federal government, like Greg, comes back to Tennessee to cover health care. And the way Insure Tennessee works is the way a lot of the Affordable Care Act works. People get to choose through private providers. So it's not a socialist government-run system. It's a healthcare exchange with providers like Blue Cross and Blue Shield and other private insurance companies. So Greg can choose the insurance he wants if he falls in this gap. If he doesn't, his tax money is coming back to help his neighbor Tennesseans get access to health care. And so I would rather that money come here than be sent to Massachusetts or Kentucky. 400,000 Kentuckians are getting a Medicaid expansion program, and 0 Tennesseans are. Let's put some of that money back in Tennessee's pockets.
You're saying this is money we're going to pay anyway.
Yes.
And I think what he's saying is this is an expansion of government, and that if we don't do this and other things, then he doesn't have to pay so much in taxes. So what do you think about that argument?
Well, I think, we all pay taxes for things we don't like. There are roads that get built that I never use, but my tax money goes and pays for them. I have a 10-year-old daughter, but for a long time I lived in Tennessee and didn't have a child and paid taxes to help support schools. So our tax dollars go to help support a lot of different initiatives. There are some people who think we shouldn't be spending any money on the Department of Defense, but their taxes go and help support that. I think that Greg should, and I and others in Tennessee should get our money back and help Tennesseans out. And I think Greg would rather have his neighbors have access to health care than have that money go to Massachusetts or some other place where he has no control over it. This plan gives Tennesseans and Tennessee legislators control over our federal tax dollars. Yes, it goes for health care, but it means our neighbors are getting the health care, not somebody in some other state. It takes the control out of Washington and puts it back in the hands of Tennesseans.
Greg, thank you for that call. Let's go to Reverend Fuzz. Hello, Reverend Fuzz.
Hey, Dan. This is a hard question. I appreciate this program, though.
Well, thank you.
I wonder if your answer changed Greg's mind. I hear from a lot of people like him who, when you give them an answer, that's a good answer. They still want to discuss. But my question becomes to the legislature. I've never seen as many people at Legislative Plaza as I've seen for protesting for expansion of health care. I've seen people laying in the hallways. I've seen the hallways cram-packed with brilliant people from across this state, or good people. And I've heard of this poll that says like 75% of Tennesseans support this expansion. I want to ask your guest, what does he really think, and he's got to be brave, is behind this? Why is it that Republicans can't get 24 people to do this good thing? These are supposed to be intelligent people, and I'm sure they are. I don't I'm not railing on them or fighting against them, but there's something wrong here that you'll take up a Bible bill and some of the other legislation that's going on this session, and something as important as this with substance doesn't even get discussed. What hinders my speaker, Beth Hallwell, who's really behind this? What's the benefit for these legislators going against the majority of the citizens' opinion in this state? And if they got a good reason, I'm with them. But that's what we elect them for, to discuss this stuff. But what do you really think is behind this? Who's doing this? What's driving this? That's my question.
All right, thank you, Reverend Fuzz, for the question. What do you say to that?
Well, so I think, one, Reverend Fuzz is exactly right. There have been hundreds, if not thousands, of Tennesseans who've poured out to the Legislative Plaza. This issue, more than any other, the polling, 77, 75, 78, even Republicans in the 60s support Insure Tennessee. So the votes are there for people who will do it. My strong suspicion is people are afraid of groups like Americans for Prosperity and the Koch brothers, who have funded a lot of campaigns. They spent $8 million over the last 4 years trying to get school vouchers passed. That hasn't happened yet because Tennesseans don't want school vouchers. But by the same token, that group is spending money putting together front groups, contributing to campaigns, sending out mailers. I got 7 mailers from one candidate, for one candidate in the 2014 elections. Every one of them had the AFP seal at the bottom. So Republicans know, and Speaker Harwell knows, that if she comes out for Insure Tennessee, Americans for Prosperity is going to spend against her. I think the voucher fight, the legislature, is a perfect example of Tennesseans don't listen to these outside big money special interest groups. And so Reverend Fuzz is right. The people who've showed up day after day after day, they live in Tennessee, not Washington, where AFP funds their campaigns. But we need to get the outside special interest money out of here. But that's what they're afraid of. Speaker Harwell's afraid of this outside money. Maybe she wants to be governor.
And the outside money buys commercials, and it would buy an advertisement that might say something like, you know, so-and-so supports Obamacare.
Absolutely.
And there's a picture of President Obama, and there's a picture of whatever legislator, and in Tennessee, that's bad news for a lot. It means that you get a challenge from the right. It means that they are challenged, and that's, I guess, what's stopping this.
Right, but I think to Reverend Fuzz's point, you're exactly right. It buys ads, it buys mail pieces. There are thousands of people who would come out. They came out to the Legislative Plaza. They would come out and vote for a candidate who was willing to expand access to health care. This is an important issue for Tennesseans, and actual voters would overcome the millions of dollars, just like they have in the voucher fight. AFP's been spending millions in Tennessee to get private school vouchers from our public school money. They haven't been successful yet, and they keep running ads and sending out flyers. They would do the same thing on health care. That's exactly right. But leadership, you know, there are a lot of people from all parties who would support a Speaker of the House who could get Insure Tennessee passed if she were to run for governor. So leadership sometimes is risky and it seems scary, but it's also what separates you from being the everyday candidate when you're running for a higher office. So if I were the Speaker and considering running for governor, I would take that risk and take on AFP. Most Tennesseans are on the other side of this out-of-state special interest group.
Do you think that the prudent thing to do is to wait? I mean, we're having a presidential election. There will be a new person in office, and just wait. Maybe President Obama is such an unpopular figure in Tennessee. I mean, most of the lawmakers in Tennessee come from rural areas where he's not that popular. Do you think by putting it off for another year that politically that is a way that this thing gets passed?
I think it's possible. I'm not entirely sure how popular a President Clinton would be, for example, and we don't know how that's going to turn out. But,
right.
But may have the same problem as a President Obama. So I think we have a Tennessee plan. It's a middle of the road plan. It's actually a compromise. It's not the Medicaid expansion a lot of advocates wanted, but it is a Tennessee specific plan. We have people like Dr. Richard Briggs from Knoxville who are supporting it, Republicans. So you have people from both sides of the aisle. You have Tennesseans, Republicans and Democrats, who are polled and say they want this. It's a winning issue if it's framed correctly, and I think that's a question of leadership. And that's where I think I fault Speaker Harwell. She should be out front leading on this, and I think that could be a great legacy for her. I'm not sure the dynamics change a lot depending upon the outcome of the presidential election next year.
What we're talking about, 250,000 Tennesseans would have access to health care that don't now. So if they were organized, it seems like they could make a lot of impact. But are they? We have seen some people up the legislature. We have seen some of that. But this group of 250,000, are they just in a position where they've got so much else on their plate? They're not part of the political process. Are they appropriately organized? What about that number? And
well, I think one of the things, especially last year during the special session, and even after, one of the things I heard from legislators a lot is I get more calls on Insure Tennessee than anything else, and that the calls, by and large, were running in favor of Insure Tennessee, now opposed to Obamacare, but in favor of Insure Tennessee. So I think to some extent the people who would benefit are organized. To be really clear, the people who benefit from this make about $8 an hour. They're people who are working jobs. They maybe make between $16,000 and $20,000 a year. So they're people who work in 2 or 3 jobs to make ends meet. They probably don't have a lot of time to go and visit the plaza. And with that being said, there have been demonstrations consistently at the Legislative Plaza, even into this year when there hasn't been a vote or discussion on Insure Tennessee. So I think that group would show up and vote. That group would make phone calls. And to some extent, a large number of the people in that 250,000 just aren't able to be super engaged in the political process.
And I think you really, when we're talking truth, and we can do that in a show that lasts an hour, it's more than just a soundbite, you nailed it on the head. The concern on the part of some of these lawmakers is that Americans for Progress, some of this outside money that's going to come in and they're going to just bomb them with a commercial saying they support this and that, and it's going to be devastating to them politically, and there'll be a challenge from the right. And so that's the concern here. How do you combat that?
Right.
Is there another side that can put enough money in to save them, or does that tying them to President Obama or Obamacare is that it?
Well, I mean, I think that's definitely a scary thing politically. I think historically Tennessee has been a state. We have Governor Haslam's a moderate governor. He was the middle of the road mayor of Knoxville, picked a Democrat to be one of his top aides, who went on to become the mayor, Madeline Rogero. So worked across the aisle. Lamar Alexander and Bob Corker, who I both mentioned, are middle of the road. They're not far right. And they've both withstood Tea Party and right-wing challenges. And so I think there's an example in Tennessee where most voters want a middle-of-the-road candidate. Now, is it scary to think about all the money they're going to spend? Absolutely it is. And I'm not running for office, so that's a different game. But being a leader and coming out first for Insure Tennessee, for a Tennessee-type plan, and providing health insurance, making sure hospitals stay open, that's a winning message that counters that argument. Hey, this guy was with President Obama on healthcare expansion, but look, I saved our hospital and our community. Now, what's going to get you more votes? Some outside money talking about, scary President Obama, or you saved the hospital and jobs and health of people in your community? So
okay, all right, we're going to take a break. Hold on the line. We're going to come back. I'm going to start going through the phone calls. So hold on. If you want to call, a couple lines open, 615-737-7587. Take a break. Be back right after this.